if a patient came in and said they had their examination by their OB and said, Dr. Lipman, I don't think I'm a candidate for this procedure because I have either too many fibroids or the fibroid that the OB has measured is way too big. Yeah. Is that something that, is that a challenging point, or is that something that we could get around?
It's a great question, because I hear that a lot in the office, that women will say, my fibroids are too big. I heard about your procedure, but I'm not a candidate because my fibroid is too big, or I have too many fibroids. That simply is just not true. I'm not sure where it comes from, but it just speaks to the point. It's really important. If a woman is suffering with fibroids and she's interested in these non-surgical approaches like uterine fibroid embolization, she really needs to speak to an interventional radiologist like myself. Those are the experts in these minimally invasive targeted treatments. And so the gynecologist may know about the procedure, but since they are not trained in doing the procedure, they may leave the patient with some disinformation or false information inadvertently. So you really need to get a second opinion. Seek out the interventional radiologist that does the UFE and ask them, am I really a candidate? Because almost anyone that has been told they're a surgical candidate is a candidate for embolization. There's very few exceptions.
And I want to ask a question I think Dr. Mack began to touch on. Are there ever too many fibroids for this process, this uterine fibroid embolization?
Never too many. And the nice thing about the uterine fibroid embolization versus some of the surgical options like myomectomy, for instance, with uterine fibroid embolization, whether you have 1 or 100 fibroids in your uterus, it treats every single one of them. Surgically, they can't possibly take out that many fibroids. In fact, most women that have myomectomy, they take out a few of the fibroids, but most in number are still in the uterus when they wake up from this major surgery, because you need to be able to have an intact uterus, you know, when they wake up, and that's a risk. There's about 5% of women that wake up without their uterus because they can't physically get the uterus back together. So the UFE treats all of the fibroids.